Development in COVID research, just as childhood cases are skyrocketing. Tonight, a Utah family who knows the toll of a missed diabetes diagnosis can take is hopeful more people will learn the symptoms to watch out for and remember their daughter's story. Sheriff Park has their story.
Keep reading.
It's been 7 years since we first introduced you to Kycie Terry.
You.
The bubbly, beautiful 5-year-old had everything ahead of her when she came down with what family and doctors thought may be the flu. They'd come to learn that Kycie had type 1 diabetes.
It was the perfect storm.
Her blood sugar got so high she went into diabetic ketoacidosis, and further complications caused her to suffer a brain trauma. Her life would never be the same.
They just told us that she would probably never breathe on her own and she would have zero quality of life.
But she was a fighter.
Pull your arm. Yes.
Good
Very
girl.
good.
Her struggle through recovery inspired people all over the world and helped bring awareness to the signs of diabetes. Countless other children and adults were diagnosed thanks to Kycie's story.
We still, even 7 years later, get messages of people who have seen the signs and symptoms from different people posting it.
And though her fight ended just a few short months after she was diagnosed, Kycie's spirit lives on, and her legacy continues to save others.
Her story is definitely not forgotten.
A new billboard campaign now lines the side of I-15 in Utah with Kycie's picture and a striking message. Kycie should still be alive.
It's a hard thing to see that your daughter should still be alive. If she was diagnosed before DKA, none of this would have happened.
Her diabetic symptoms mirrored many other childhood sicknesses, a headache, a stomach ache, fatigue. But just a little bit of extra knowledge could have changed Kycie's prognosis from fatal to manageable.
Extreme thirst, extreme weight loss, fruity odor on the breath, frequent urination.
If Jamie and I knew the signs and symptoms, we could have recognized it earlier. That would have helped that physician, that doctor, understand what was going on better, but we didn't know.
With studies showing children who contract COVID-19 are at greater risk of developing diabetes, it's more important than ever for Kycie's story to be seen.
It could be something more than a cold, could be something more than a flu, could be something more than COVID. It's important to consider type 1 diabetes. It's got to be the patients and the doctors working together. If we knew the symptoms, if they knew the symptoms, she'd still be alive.
Know the symptoms. It could save a life.
Why did her story get big and why did things go the way it did? We ask ourselves that all the time. But I think it just comes down to that it was her purpose, and it was her plan. And I think there's definitely a reason behind it all. And we know that now.
All right, now Sheriff Park reporting. It's important to note you don't have to have someone in your immediate family who has diabetes to be at risk. You can read more about Kycie's story and the campaign to raise awareness at ksltv.com.